Okay, which of the following histopathological findings would confirm the most likely diagnosis? Caseating granulomas, eosinophilic infiltration, histiocytes with elongated bean-shaped nuclei, non-caseating granulomas, and smooth muscle proliferation. This is a 28-year-old female presenting to the clinic with a 6-month history of a non-productive cough, shortness of breath, and fatigue. She has a 5-pack-year smoking history. Physical exam reveals crackles in the upper lung fields bilaterally. Pulmonary function tests show a mixed restrictive and obstructive pattern, and a CT scan reveals cystic changes in nodules predominantly in the upper lobes. So, upper lobes. Shortness of breath, non-productive cough, fatigue. What is found in the upper lobes? I literally just read this yesterday. Um, do, 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 do. Um, Cystic changes in
Yeah, this
nodule.
question is kind of hard. The diagnosis is pretty rare, but this sounds kind of
Yeah.
difficult.
This is, yeah, I was like, this definitely isn't like your most common. And like her smoking history is almost like it's very relatively small for like some kind of cancer. If this is a rare diagnosis, I'm just gonna have fun and say histiocytes with elongated bean-shaped nuclei just to be different.
Yep. Okay. So this, so yeah. So this is Langerhans histiocytosis. This is very,
Doesn't
very
that normally happen in like
yeah,
kids?
usually kids. But I think just because like, cystic changes and nodules in the upper lobes is very, very rare. And also on top of that, right? She's relatively still young, 28. You can get some bone stuff going on with this too. But I would say this is a very difficult question and very low yield question, I would say. But it doesn't fit with anything else if you think about it, right? 5 year smoking history, that's too early, right? 5 years, unfortunately, of smoking is probably not going to cause you anything unless you have like a alpha 1 tryptan deficiency, right? Which it will give you emphysema. Casein granulomas, that's going to be like TB. She doesn't fit TB picture, right? Eosinophilic infiltration, more of an allergic kind of ordeal like asthma or something like that. Non-casein granulomas like sarcoidosis and other autoimmune disorders. Smooth proliferative, muscle proliferation. Maybe that's something like, primary, what is it called? What was it called? COPD is one of them, but the other one, man, I can't think of it. The one that affects women, idiopathic pulmonary hypertension. Yeah, that's what it is. Idiopathic pulmonary hypertension, which does also affect women too. But yeah, this is a weird question, I would say.